happening, guys, and welcome to this week's It's All Blakademik with me, Jordan Jarrett-Bryan. Now, on the show this week, we're going to have a chat, a discussion around racism in medicine. Okay, so now we've all seen the fallout of the pandemic and the lockdown due to COVID-19 during the spring period. And many of our community have died, lost their lives. But I'm really interested to kind of extrapolate the whys and get to the roots of what we're being told in mainstream media is indeed true or false, but also the experience of working for the NHS in this country in particular as a Black person. And to do so, I've got a really strong panel with me here today, starting with Professor of Black Studies and author, Dr. Kehinde Andrews. I'm also joined by Reader of Toxicology and Biochemistry at the University of East London, Dr. Winston Morgan. And third, but not least by any means, I have medical student and a member of the charity Melanin Medics. And she was also, got to put some respect on this woman's name, she was also invited to the White House by the former First Lady, Michelle Obama, Khadija Owusu. Guys, how are we all doing today? Are we well? We nice?
Yeah, good.
Good, thank you.
Yeah, we're good. I'm good.
Good. So guys, I want to start off by not asking you whether you think there's racism within the NHS and the medical profession in this country, but I'm really keen to find out how much racism you guys think there is in the NHS.
The current climate with COVID-19 has definitely brought it more to light to show that it's been an issue for a very long time, and it's now that people are essentially listening, people are essentially hearing that this is what has been going on for a very long time. And it's, of course, it's unfortunate that thousands of lives have been lost during this period, but now at least it has been brought to the forefront and conversations are being had, actionable points are being made, and action is being made towards this issue.
And what are the gentleman's views on how much of a problem racism in medicine and in the NHS is, in particular, obviously for Black people? Kehinde, do you want to pick up?
Yeah, I mean, health service, NHS is no different than any other part of society. I mean, we live in a racist society, so why would you be surprised that there's racism in medicine? And that's been the big takeaway from me from this COVID thing, has been why anybody would possibly be surprised that Black people and minority ethnics are more likely to die, because that is just the experience across most health inequalities. You find that same thing. So I think if you really look at it, the evidence is clear, and COVID's just the latest in one of a very long line of examples that there is lots of racism in medicine today.
Well, I'd say that basically it's a reflection of society. So because we have there is racism and structural problems in society, it's going to be reflected in medicine. And what COVID has really done is COVID is like a stress. It's stressed the system, and it has exposed the racism that's always been there, and that's what we're seeing. So yes, there's racism in medicine just as there is in every other areas of society, and COVID has just exposed it. But it could have been an economic crisis, and we'd have seen a similar kind of thing.
Khadija, could you give us some kind of real life examples of, during this period in particular, or as someone that's been working on the front line, of examples of blatant racism? So someone, working in the hospitals, the engagement with, senior nurses, just that particular environment and industry. Give us some examples of what you would say is an example of racism for Black doctors and nurses.
Yeah. So within the healthcare profession, a lot of the time the racism can either be overt or it can be sort of implicit, pushed under the rug, what we sometimes call the unconscious bias, or even so microaggressions in the workplace. And when it comes to overt racism, it can be from your colleagues, but also from your patients, for some reason, a random reason, or a deep underlying reason. Because of the color of your skin, these other healthcare professionals or counterparts from different ethnic backgrounds seem to have a problem or comment on essentially your Blackness, or just the fact that you are Black. It is appalling, and you can even have patients tell you they don't want to be treated by you because you're Black. And it's very sad. There are a lot of stories, and even on the part of Melanin Medics, we do have doctors and even medical students, allied health professionals come to us, tell us their stories of what they are experiencing day to day in the profession which they studied extremely hard for, the profession that they completely deserve to be, the place that they deserve to get or to have. For them to be treated in such a way is completely appalling. And changes definitely need to be made from, of course, from the ground level upwards, but we also need to remember that this is an institutional thing. The people at the top definitely need to be making rules, build in policies to help bring about a change.
And Kahindi, as someone that's a historian, the history, someone that studies the history of black studies and specializes in that area, talk to me a little bit about the kind of overlapping of racism that goes within the history of this country and the NHS in particular.
Well, yeah, it's interesting because the NHS is really cherished. Also, it's a place where lots of us work, right? I mean, if you're Caribbean, I think pretty much everybody's got a nurse in their family. Like that's a standard, right? So it has been a place where we've got employment. It is also one of the most diverse workforces, as well as being it's the third largest workforce in the entire world. So in some ways, the NHS can seem quite progressive. Lots of Asian, there's lots of black staff. It's a place where we get jobs and stuff. But actually, if you look at the history of it, it's really not there at all. It is a history of colonialism. I mean, it starts off as a national health service in 1948. But most of the colonies are still part of the empire, right? But it isn't a health service for Jamaica or India or the Caribbean. It's a health service for this little island where all the people are drained out effectively from the Caribbean, from India, and from the different parts of the world. And that still is the case today. And it kind of has this deep colonial links. And if you look at one of the reasons why is it that of all the healthcare staff, there's such a predominance of black minority ethnic people? It's because of the place that we are in the NHS has always been on that kind of front line. Where black people are going to nursing and they're on the front line. Even the doctors are more likely to be on the front line. And it is this kind of disposable use of black bodies for the health service. And if you look at the structure of it, so there was a report a couple of years ago called Snowy White Peaks. And they looked at the NHS and looked at the top of the NHS. It's just almost all white people, right? There's very little progression. There's huge problems in terms of bullying, harassment. It's just a really terrible colonial institution, which unfortunately has perpetuated racism rather than combated it.
And Winston, so we've been told throughout this whole period that black people are dying at a higher rate because there's something about us that makes us more susceptible to this particular disease. Talk to us a little bit about why you think that's absolute nonsense and what the work you've been doing has been debunking that really dangerous myth.
Well, let's go back when the pandemic started. First thing I noticed was that basically they were using race to explain, if you like, the impact of COVID-19. So they'd come on the newspapers, TV, whatever, and they'd be talking about COVID-19, and they'd be using race to explain its impact. And then I also noticed that they were also using, if you like, COVID-19 to redefine race and what race was, if you like. So I found that really challenging and disturbing because I can see lots of consequences for that. And as a bioscientist, I know that basic race, because it's as Kahindi will confirm, it's if you like, it's a social construct. There is no scientific basis towards it. So if you're going to link something that, if you like, we understand, like the infection of a virus, with science, you can't then link that to something like race. There's no connection, but yet they were trying to make this connection, and that really worried me. And then they'd also add things like the pre-existing conditions like diabetes and cardiovascular disease and all of those things. And because, for structural reasons, our communities tend to suffer more from those conditions, they were then linking those to COVID. And the whole thing was just getting, if you like, conflated and confused. And I think it was giving ammunition to those people, because there are a group of people in our society who'd love to show that there are actually serious differences we're talking about biological differences between different human groups. And this was, if you like, this was ammunition for them. So I wanted to challenge that. That's been the main thing I've been trying to do over the last 2 or 3 months in my writing, to try and sort of challenge these assumptions, because most of them are not based on, if you like, scientific fact, but just based on people's assumptions about race.
Yeah. Even just to add on to that, it even highlights the other health inequalities. For example, how black people or black patients are seen to be able to have a higher pain threshold. And it makes you wonder, So I've been in medical school for 5 years now. I have a couple months left until I officially become a doctor. And it makes me go back and think, okay, in my 5 years of medical education, where was the point in which I was taught simply having more melanin in your skin means that you can take on suddenly so much more pain that you are then refused to receive the adequate pain management you need to treat your condition or your disease. And then that is what leads to these medical students or even doctors having these false beliefs, which eventually leads to more Black people dying. If we look at maternal mortality, women are 5 times more likely to die from giving birth. But then it's like when you read deeply, as Dr. Winston said, physiological differences cannot be the reason, because if that is the case, then it's only feeding the ideal or the narrative that white women have ideal bodies, and so Black women or other ethnic minorities have defective bodies as to why they can't give birth. With coronavirus, why are Black people dying more? Let's take a look back home in Africa, countries back home. Are Black people dying more over there? Clearly, it's not due to race. There's something else in the system that's killing our people.
So as you can say, that was one of the things that was the most interesting, is that, look, COVID's tore through the West, right? It's Europe, it's America, it's basically white countries where it's devastated. So you'd think it'd be pretty obvious to see this is not a biological thing. And the reason that we, even both in America and here, the reason why Black people are more likely to die from this is nothing to do with genetics. It's everything to do with society, right? It's about the fact that almost all of us live in cities. We live in not just in cities, but inner cities, so crowded. We also tend to do key worker jobs, far more likely to do key worker jobs, so to be exposed, far more likely to be on public transport, far more likely to be economic disadvantaged. So it's clearly a social aspect, but actually you still hear this nonsense about genes and take some vitamin D, which just tells you how deeply rooted these race are and biology are and how we understand things.
Most of the challenges I've got are from people trying their best, sending me lots of research papers, trying to prove that there is a biological difference. You get as I said, a small population of people who just want to prove that there's this biological difference between different races, and they'll do anything to do that. And it's really frustrating, really challenging. But you have to challenge it.
No, totally. And just go back to kind of Kahinde's point there about the fact that so many Black people are dying is because of the roles and the jobs that we do in society. It was really annoying and frustrating for me personally, seeing members of our own community spending so much time trying to lobby government into reviews and investigations, into looking into why Black people were dying during this period. When for me, it was obvious where I live here in South London, the people that clean the streets, that drive the buses, that are the Uber drivers, that are on the front line of the NHS, the kitchen porters, they generally are Black people. So the issue really for me wasn't, well, why are we dying? The issue for me was we should have been lobbying people to protect us. So if we are going to be cleaning the streets, driving the buses, driving the tubes on the underground, can you protect us? Did anybody else get a bit frustrated at the fact that there was too much time spent on trying to find out the why and not enough time working out how to protect us if we're going to be doing these jobs?
Yeah, I mean, the why is up like, I mean, so I wrote this, like, I'm not even an expert on health. Health inequalities is not my expertise. But I wrote this, like, most of it, like, literally, I could have written it before the whole thing started and said, this is why. Because it's obvious. Anybody who's paying any attention would know that A, we're going to be more likely to die, and B, the reasons why we're going to be more likely to die. But unfortunately, the media, the government have so little interest in these issues that it's like a surprise, it's like a shock. So the only thing they can do is say, let's have a review. Let's get Cherry Phillips on the review. Listen, like, just look at how bad that is. And then you have a review that comes out and tells us what we already knew, and then nothing happened. So it's just, that is what always happens with issues of racism. And we need to be lobbying in a different way because we know the problem.
But I understand to a certain extent why some people call for the review, because as we've said, all this information was coming out. We were challenging it. We were saying it's not genetics. It's down to social conditions. But unless you actually, people aren't accepting this. So we then said, well, let's provide some evidence. And that's what, in a sense, the review did. And it came up to me with some really important recommendations in terms of how the system needs to change if we're gonna move forward. So there were some positives out of the review. Yes, I agree. We could have predicted what their conclusions was going to be, that it was going to be structural racism. But by having that review, it sort of, hopefully, it might stop some people from making excuses.
Does anybody think that this period has made us, as the UK, value the NHS even more, and the positive impact of valuing it more during this particular period is a reduction in racism, or is that a very, very naive question to ask?
For me, I would say it's partly a naive question. In terms of everybody appreciating the NHS,
I can take it.
yes, sense that, well, their form of appreciation is claps every Thursday, but real appreciation is, think about the professionals who are every day leaving their families to risk their lives to save others. How about you perhaps solve some of their issues? We leave medical school, nursing school, midwifery school, or the allied healthcare professional university degrees with thousands and thousands of major debts that we still have to pay off. So it just makes you question the extent of their appreciation. Claps, they're nice, but to a certain extent. Are you going to finish paying my student fee loan? Are you going to wipe it out? Are you going to give me the adequate mask and protection that I need? No.
Trying to get a pay rise. Can't even get a pay rise.
There you go.
And in a sense, that's the real problem about the NHS. And one of the reasons why you found more black doctors and Asian doctors suffering more is because they're the ones who are, as Kahinda said earlier, are in those inner city hospitals on the front line. And one of the things, remember, older people are more likely to die. So what you'll find is, because of the structures of the NHS and how people progressed, you'll be an older doctor in that kind of frontline position, and so you're more likely to suffer because of those structural positions. Whereas normally, many of the doctors who've died wouldn't be on that kind of frontline service. They might be perhaps in a quiet GP practice somewhere, not in the hospital on the front line. So those are structural problems within the NHS that needs to be tackled, and also having the power to make sure that those other workers in the NHS have, for example, proper PPE. That was one of the big issues, which led to the higher numbers of sort of the nurses and the healthcare assistants and whatever suffering more because they didn't have access to those PPEs, and there was no one in the senior position to say, why aren't these people also getting it? So the structures within the NHS needs to be changed, and that's what I think that's some of the things that the review actually recommended, that we needed to look again at how these organizations are put together.
Yeah, and I think also like the social care aspect of it, can't miss that either. Because I mean, the social care, you look at care workers, again, disproportionately likely to be black and ethnic minority. That's really low paid and nobody cares, and there's very little applause or anything for that sector at all. And so, and I think it just goes back to like when they founded the NHS. One of the reasons that they brought over Caribbean nurses, Asian nurses, is because they didn't want white women to do that labor. Like they thought this is really frontline labor. We don't want white women doing this labor. This is actually one of the main drivers for getting that colonial workforce in the first place. And I think if we're honest, that's still there today, right? Like you've got, why are there not nursing bursaries for people in the UK? Part of that is driven by this idea that this kind of work, that kind of caring work, that kind of frontline work, and particularly social care as well, that isn't work that we really want to do, and we'll get black and brown people. And now you're seeing and COVID's just shown you what one of the results of that could be. I don't know. And in terms of appreciation, like I said, there's no real appreciation. It's just clapping, a bit of token, this and that. But have you seen anything back from the government yet? I ain't seen a thing. It'd be interesting to see where it goes forward, but I strongly doubt that 70 years of history is something going to change.
So having said all of that, guys, radical idea, but is it time we took our skills and went elsewhere or did something else? Because I think it's disgusting that at a time when the country needed its nurses and doctors to save them, many of them were members of our community, were black people, and they weren't being protected in protecting us. So we all know a family member, or maybe we're in families where going into medicine or being a doctor or a nurse was something that our families told us they want us to do. That's the route we want you to go down. I don't know if that's changing now, the new generation of black people, younger black people, but do we need to take our skills and say, you know what, if you're not going to protect us when we're here protecting you, you know what? Cool, you have it to yourself.
But where when you say go elsewhere, what do you mean? Because the,
I don't
the
mean I don't
point
mean
is, we
geographically. I
live in
mean,
yeah, because I'm just thinking, we live in a highly racialized society with lots of inequalities, and it's in every sector. So you're a talented young boy or girl leaving school, going to university. There's going to be racism and those kind of challenges in whatever profession you go into. So it's not a matter of going somewhere else.
but isn't the difference? Isn't the difference? Sorry, that in this profession they're being killed. Black doctors and nurses, because they're not being protected by the government they're supposed to be serving, they're dying. Whereas I accept there's racism in every industry, but not every industry as a result of it are you going to die.
Mm. I think if we do take back our skills, who is going to be left to look after our people? Who's going to be left to look after our parents, our children, siblings? So in that sense, I do think we cannot take back our skills, but definitely a lot of health professionals nowadays, a lot of Black medical doctors nowadays are starting to go down the entrepreneurial route and start opening their own practices privately in order to help people of similar backgrounds. Now, going down that route is definitely important for our communities, but we also need to consider the people who won't be able to necessarily afford those. And with that being said, we definitely would need to keep our skills within the NHS in order to help our communities. But with that being said, we shouldn't have to risk our lives while doing so. Otherwise, if we're gone, who's going to look after them? And then for that reason, we do need to have the adequate protection in place, which is up to the government to, take more seriously and do something about. But in terms of our children, are we teaching them to still consider this path? I think it is not being emphasized as much in schools, especially in state schools. So I do a lot of outreach going into these schools, especially across London, speaking to state schools, government funded schools, so areas like Islington, Hackney, and just speaking to these students, it's almost as if there is some sort of invisible glass ceiling or a barrier to which the students feel as though they won't be able to achieve such careers, becoming a doctor or a lawyer or any other similar career, going down any other similar career path. Now, for that, those could be due to environmental reasons, having teachers who don't really know exactly how to get into those particular career paths, or teachers who mostly don't really believe in them, which is what leads to the whole idea of, if students are being given their predicted grades, the Black children are going to suffer during this period, because already teachers don't have as much faith in them as they would have in their white students. So we're disadvantaged at that level. But coronavirus, the COVID-19 pandemic, has put us another step backwards in terms of our children seeking such careers.
Yeah, and also I think that's the other thing. Like, look, the NHS is the third largest employer in the whole entire world. As much as it is problematic, the public sector generally, the NHS in particular, has been one of the places you can get jobs, and not just a job, you can get a career. Right? It's not equal, it's problematic, but it's no worse than anywhere else. It might be better than some of the private sector as well. And then if you look more globally, like, why is it still there's so many doctors and nurses coming from abroad? It's money, it's income. Like, you could be a nurse in Sierra Leone, or you could be a nurse in Britain, and where are you going to make more money? Where are you going to make more income? Which again is one of these big legacies of the NHS, where actually the NHS saves millions of pounds a year because it literally just steals nurses from places like Sierra Leone. It doesn't train them, but they come over here and then work in the NHS. In fact, at the height of the Ebola crisis, where it was in Sierra Leone, we actually had something like 20% of the doctors and nurses who were trained in Sierra Leone working in the English NHS, which just tells you this is a global problem as well. So when we think about like what draw a labourer, where are you going? Like, I mean, where are you going to go? This is NHS attracts our labour because it's one of the places we can earn a decent yet exploited living, unfortunately. And until that changes, I'm not sure what we can do.
No, I definitely consider a career in medicine or nursing or one of the paramedical sciences. Definitely. I mean, I part of my job, I do some teaching for our adult nursing course. And when you see those, these tend to be, as I said, slightly older women mainly, and some men. And they're on a new path and they're very excited. And even this COVID thing hasn't really put them off, and I don't think it should. We should, in a sense, take even greater ownership of the NHS if we're going to work in it, and aspire to get into more senior positions so that we can make those decisions. As I was saying about things like being in the management position, so you can actually say, right, we need more PPE in that kind of position. Because obviously we've learned lessons from this pandemic, so this kind of situation won't happen again. But there are going to be new pandemics, so we want more Black people, more Asian people in senior positions in the NHS, so that they can actually really control what's happening, rather than be bystanders and victims. And also
That was actually going to be
the patients need us to be there.
Yeah. Well, that was actually my next question was going to be. I'll ask the two other guests. You kind of answered it there, Winston. Do we wrongly assume maybe that having more Black people in senior positions within the NHS will help Black people, long term, or is it dangerous to think that just because we now have a Black head of the NHS, a little bit like the Obama effect of America, just because we've got a black president, that doesn't mean that Black people are going to be better off? Or is that an answer to addressing how we are treated within this country medically?
I think it is wrong to, well, in my opinion, I think it's wrong to assume that. We definitely do need more representation at senior leadership in the NHS. I was reading a statistic, and it was saying 92% of those sitting on the NHS boards are white males, and this has actually increased from 85% in the period time bracket of 2018 to 2019, which you would be thinking is going the opposite direction, but instead it's increasing, which is getting much worse. And so it just fuels the problem, the whole institutional racism that's going on. It's starting from the top downwards. It is essentially a bunch of white men sitting around the table who temporarily want to wear the savior, let's save racism, let's end racism complex hats, and essentially want to try and fix these problems for which they have no idea, they do not understand, or have empathy towards those situations. And the only way for us to do that is to get people like ourselves sitting at those tables. But it's not for you to only get the one person at the table and have them as your token, but it's for you to have representation at all levels in the system in order to help bring about positive and accurate change.
Winston, let me ask you: do you care of the ethnicity of the person that is helping you? So if you goes to the doctors or you go to the hospital, does it matter to you if that person is Black or not, or is your primary concern that how good they are?
Well, on an individual level, I don't care, but because I'm a scientist, I look at numbers, and I'd want to know that the probability of me getting someone who looks like me treating me at some stage, if I encounter if I enter the NHS, is a reflection of the number of people who look like me in the population. So yes, on an individual level, it doesn't necessarily matter, but it does matter in terms of numbers and statistics. And also, sometimes someone from your background will have a certain insight that others might not have, whether it could be about your diet, it could be about certain habits you have, that's a legacy from your culture. That's also important. It informs how you're treated. And also, another important thing about that is it will actually help the other doctors. If you have a doctor and he or she has never met or worked with another doctor from another ethnicity, but he has lots of patients from that ethnicity, he'll have a kind of, he'll have a different view. Whereas if he has a colleague who is from the same communities as his patients, he will perhaps respect his patients more and treat them better, and not see them as, if you like, as inhuman or less human or whatever. So it's really important that you have someone from different communities in the medical profession, in any profession, really.
Kehinde, let me ask you, during the last kind of couple of months where there were so many protests linked to Black Lives Matter, the kind of the blowback from government and people that didn't understand why they were protesting was, there's a pandemic, you guys are more likely to get it. Why are you guys going out and grouping up and putting yourselves in a position where you guys can die? What did the fact that so many Black people were still out because they believe they're still out protesting during the spring? What did that say to you about how we treated and our thoughts on on the coronavirus?
Yeah, I mean, it's just a reminder, look, racism is a matter of life and death. And the fact that so many people are going there in a pandemic, which is more likely to kill us, and we still think it's really important that we go out and protest, just tells you the level to which we should be taking this seriously. And we don't take, so when we're protesting about racism, I mean, that's what we're protesting about. COVID, the disparities are produced by COVID, produced by racism. And it's not just that, it's police brutality, it's everything else, it's all these other indicators, right? And so we have to make our voices heard and be known about that. And I think also, just tying back to the last question, one of the things which this generation are finding is that, for the last 50 years, we've kind of gone on this route that says, well, look, if we can get into these institutions, it's only 1965 that it was illegal not to discriminate on the basis of race in this country. So we kind of been on this track where if we can get into the institutions, if we can get some representation, maybe we can get some black politicians. Hey, America had a black president. As things are going to get better. Unfortunately, things haven't got better. Things are still exactly as bad as they were before. And so I think that is a reminder that we need to change in institutions. And that's why people are still at protest and will continue to protest until there's meaningful things.
And Khadija, as someone that works in the medicine profession, were you slightly conflicted when you saw so many black people out protesting? Because I don't know, did your professional side think to yourself, this is really bad for our community? And did the other side, did your personal side think, but this is a necessary evil?
No, of course, definitely, because of course, we were hearing being black, you're more likely to die from COVID-19. But on the other hand, we had thousands of people on the streets marching, protesting for this serious cause. So, but what made me sort of at ease was seeing how people were, making sure that they were socially distanced. A lot of people were wearing their masks, had their sanitizers. So people were taking the necessary precautions. But I definitely believe that they needed to do that in order to bring up awareness about the Black Lives Matter movement. So of course, it was very divided, but I was here for it. I am standing by them, and that was what needed to be done.
Yeah, the protesters are taking more effort to protect people than the government. I mean, this is the same government that has so many mixed messages, didn't shut down the economy, has kept Dominic Cummings still in power, wants to lecture people about about taking precautions. I mean, I protest. I would usually protest, but we had very clear guidelines when if you have someone vulnerable, don't come. Make sure you're wearing a mask. Make sure you socially distance. Make sure that you for 2 weeks you isolate after. So actually, the protesters were thinking about this. We all were on our minds. Like I said, far more than the actual government.
Yeah.
And just going back to the question, I'm really interested to know what you think about the question before last, Hindi. How do you care about the ethnicity of the caregivers, the nurses, the doctors that will be serving you if and when you should need the medical help?
Many examples where it does matter, right? If you think about the pain example that was given before, you think about the racism which just generally permeates through the NHS. I mean, you got that brother, I can't remember his name, but he's making this medical student, right? He's making a different advice because they don't talk about race in diagnosing things like that. It tells you that it does really matter, right? There are certain things which you do need some representation there. I mean, on the one hand, look, as long as I don't die, do I really care if it's white, black, or Asian doctor? But I do think there are some really specific examples where it does matter. And I think sometimes we forget that medicine's like any other discipline, is Eurocentric as anything. And we do need different perspectives to fully understand what's going on.
I just think that's a really important point about the research in medicine, because that's some of the things I look at a lot of scientific papers now where the basis for example, in blood pressure, there's a different treatment for if you're a black man versus if you're a white man. Now, when I've been looking at the research that underpins that, and some of it is quite dodgy. But because and someone like me, I can see that. For example, they make assumptions about black South Africans versus West Africans, and they assume that every African is the same, and all kinds of assumptions that they make that they can't see. And so that's another reason why you need, if you like, people who know and understand these communities to sort of help in terms of research and direct the research so that people don't make these mistakes, because our community will suffer if you're giving the wrong treatment because you haven't really understood the communities. Then it's quite a dangerous thing.
And Khadija, same question to you. Why is it important to you, if it is indeed, the ethnicity of the person that, should you need help, is serving you?
So I would say in an ideal world, it shouldn't matter. But because of the society that we live in today, it does matter to an extent. It matters because you're there to advocate for your patient. You're there to ensure that. So, for example, communication barriers. If you have a patient that is of the same ethnicity as you can definitely communicate with them in that same language that you both share in order to receive all the information of that patient history. Because often, sometimes patients are shunned away, or they're not taken as seriously because of the fact that they simply may not even understand English. It's all about catering towards their needs and adapting to the different needs that every single patient has. And in order for us to do so is to ensure that we maintain the diverse workforce that we have. But the people looking after the diverse workforce need to understand and take them seriously, but also have rules and policies in place to ensure that they are protected as well.
And just finally, guys, solutions. So, what lessons can we learn from COVID-19 as the Black community kind of going forward? And as a kind of addition to that question, how much self-responsibility do we have to take? Because we can lobby and push and expect our government to do better by us and to not put out propaganda of scientific lies about the makeup of our bodies and the chemistry and all that sort of stuff. But what can we as Black people, what should we be doing to ensure that we are doing the best that we can to ensure that we're giving ourselves the best chance of living healthy and living full stop?
Well, I mean, sorry. So I mean, like racism. I think we have to remember that racism is a matter of life and death, and none of these things are separate. So I think that's really important. This COVID thing is not a health thing; it's a structural racism in society. There's no way you're going to get good health outcomes when we live in a racially unjust society. So we really have to connect these things together. I think this government has shown very clearly that you cannot rely on the government at all to address these issues properly and sincerely. And so therefore, we need to be doing what we need to do to ensure that we are building and we are making alternatives and that we are improving the conditions that we live in. That's really the only way you're going to get good health in the community, is when the economic and the political health of the community is strong as well. And I think that is up to us to do, and we can't really rely on the government or anyone else.
Yeah, I'd say most in our community, I would say, wouldn't have been surprised by what's happened, because as others have said already, it's happened before and it's happening all the time. So it's not a surprise to us. What we really need to do is to, I don't know, get in there, if you like, and sort of be more influential, more vocal when nonsense like it's about you being Black while you're suffering from COVID. You go out there and you challenge it. Just be prepared to do that rather than just accepting it and start worrying because the newspapers are saying, Black people are more susceptible. So it's about challenging these sort of negative narratives and confronting them and forcing the government politically, like people did on the streets with Black Lives Matter, and actually sort of, forcing them to at least look at things. Whether they do anything is another matter. It's constantly challenging these sort of like these sort of negative narratives about who you are and what you can do.
Yeah. And just to add on to that, definitely, well, in terms of Melanimedics as a charity, we are definitely continuing to advocate for our medical students and our doctors who are of who are Black, advocating on their front, ensuring that we are working with the General Medical Council as well as the British Medical Association to have institutional change there. We need to see a representative leadership board across all levels within our healthcare systems. But we also need to emphasize the important point of having allies, as well as advocates to help support us. Because during this particular time, a lot of people have been able to stand up and challenge these situations that are occurring. A lot of big brands that we know have been essentially shaking in their boots because of what is going on to end racism within their particular industries. And so we can definitely do the same for medicine, for healthcare, and ensuring that people stand up for us. This is a fight for everyone. It's not a fight for Black people only. Everybody needs to take it as their number one priority. Whether you're Black, white, Asian, it's something for us all to fight, essentially.
Yeah, sorry, just to go on. I mean, I've just written a paper. I'm trying to get it published now, and it's about how we have to ensure that medical training, basically, and making sure that doctors actually understand race and racism and how it works. Because one of the problems was that when they came on, they couldn't actually challenge these sort of racist ideas about blacks being more susceptible for genetic reasons. They wouldn't or couldn't. And partly, I believe, is because they didn't have the ammunition, the scientific ammunition to confront racism. Because most doctors now, they've grown up in a time when race is a norm. They don't know where it came from. They don't know the origins of it. They just think, you're black, you're white, and it's actually something real. They haven't realized that these are, if you like, social constructs. So they need to be retrained so that they actually understand what race is. And literally it's just skin deep.
Dr. Morgan, Professor Andrews, and Khadija Owusu, guys, thank you so much for joining me on this week's All Blakademik. I really appreciate your time. Thank you so much. Don't forget to check out our website, blakademik.com. All of our previous shows and content is on there. Lots of information about the team behind Blakademik. Also, subscribe to our Blakademik TV channel on YouTube if you haven't already. And we're across all the socials, Facebook, Instagram, and Twitter as well. Until next time, look after the people then. Stay well. Peace.